When a person injects, smokes, or snorts heroin, the drug travels quickly to the brain through the bloodstream. In the brain, the heroin is converted to morphine by enzymes. Morphine then binds to opiate receptors in certain areas within the reward pathway, including the VTA, nucleus accumbens, and cortex. Morphine also binds to areas involved in the pain pathway, including the thalamus, brainstem, and spinal cord. Subsequently, there is the development of tolerance to the analgesic's pain-reducing properties, and the body no longer responds to the drug in the initial way. Tolerance occurs in the pain passage pathway, which includes the thalamus and the spinal cord. These areas are important in sending pain messages and are responsible for the analgesic effects of morphine. However, a person does not develop tolerance to the respiratory depressive effects of heroin or morphine that is responsible for the many deaths from heroin overdoses. When morphine binds to opiate receptors, it inhibits an enzyme, adenylyl cyclase, that coordinates the firing of impulses. After repeated opiate receptor activation by morphine, the enzyme adapts so that the morphine can no longer cause changes in cell firing. Addiction develops when the neurons adapt to exposure of the drug and only function normally in the presence of the drug. Many of the heroin or morphine withdrawal symptoms are generated when the opiate receptors in the thalamus and brainstem are deprived of morphine. Withdrawal can be very serious, and the abuser will use the drug again to avoid the withdrawal syndrome. Since overdose is particularly lethal due to respiratory depression, in order to reduce deaths, naloxone, or Narcan, is being increasingly used by both healthcare providers and the general public. This opiate antagonist has no pharmacological properties in the absence of an opiate. After intravenous, subcutaneous, and intramuscular injection, it temporarily, for 1 to 2 hours, binds with opioid receptors. Its binding ability is stronger than morphine's, so it can push the morphine off and reverse the effects. A nasal spray formulation is currently available.